Okay, tell me what
All
you
right,
think.
everybody, all six.
Yeah, give me all the thing.
Alright. Imagine for a second, that your child is experiencing something they can't understand or communicate. Imagine that negative behavior becomes their coping mechanism. And this coping mechanism can be life-threatening, even detrimental. Mental health awareness for children is what I would like to discuss. And so in this section, I want you to listen to what I have to say with an unbiased mind. According to the American Academy of Pediatrics, yearly exams for children 3 to 18 years old should be routine. They should be seen every year for physical wellness. What I would like to talk about is the mental health aspect of these kids. As a parent and a future mental health professional myself, these exams should include the evaluation of the mental health of the child with no warning signs and the ones with the warning signs. Because oftentimes, silent children can't communicate, what they're thinking and feeling, and that's why they're silent. The most common disorders diagnosed among children, according to the CDC.gov, ADD, or it's ADHD, anxiety, behavioral problems, of course, and depression. Imagine a 7-year-old with depression. That's a really deep thought. Or a 7-year-old with thoughts of not wanting to be alive because they can't cope with the thoughts that they have, or they don't know how to, positively express that or deal with it. Their behavior is telling us something. The CDC.gov, again, informs us that children affected by poverty are more likely to not receive treatment. So that means children with the warning signs and without are less likely to seek treatment. So they'll grow up and never be seen by a mental health professional, and they will carry out their lives with these issues, these problems, these struggles, and these experiences that are so severe that oftentimes they don't want to live. Children coping with mental struggles equal to that of an adult. Think about that. Think about your child being as stressed out as you are. Are you starting to see what I'm talking about? Is it making you feel an urge to do something? There is a problem. That is, children suffer mental health issues because it's overlooked. They go to the doctor, they're checked out, they're physically well, they're fine. The child's not expressing any, thoughts or feelings to their doctors because they're not being asked. Did you know 1 out of 3 pediatricians report that they have the training to treat or diagnose these kids? So that means they don't know how to help them. I mean, it's great. Pediatricians are awesome. We need them, But what about the kids that need the mental health help? 1 out of 3 can help them? Often, children must display mental health struggles to ever even see a professional. So that means if they're not displaying the negative behavior, the oversleeping, the undersleeping, the overeating, the undereating, all the signs or symptoms that sometimes kids show, they're never going to be seen. There should be assessments there should be mental health assessments at every single routine exam that the American Academy of Pediatrics suggests. Every single visit, our children should be mentally assessed, you know, and there should be routine mental health assessments completed with or without those warning signs. Children are forced to obtain their own way of coping. I mean, think about it. We don't sit them down and tell them, you know, you're having these terrible thoughts, and this is how you deal with it. This is how you're going to cope with it. That's not very common. Taking action is the only option for a hope, for a future, for our children's mental wellness. And that time is now. In conclusion, the psychological need is one of great importance, especially that of a child, because children are our future. Children are the future of our society. And if we're not doing all that we can do to make sure they're well, what's our future look like? If their needs are not met, they are more likely to practice negative behavior. These negative behaviors will shape their lives. Once again, these common diagnoses are ADHD, depression, behavioral problems, and anxiety. So, my suggestion is for us to take action, and we take action by, since we're the parents and they're our kids, we get to say what the services are. And we need to use our voices and make some changes and suggest that the American Academy of Pediatrics implement mental health for our kids. You know, what about that one child that gets overlooked? You know, that could be your baby. So we need to fight for the kids that aren't fought for. Thank you.